with these new medications that reduce things like mast cell burden, and even with the other medications you mentioned, how frequently do you reassess disease status and what typically prompts reassessment? How do we know outside of, just the basic symptomatic things that things are stabilizing or getting better?
That is such a magic question. You want to go with that, Jessica? Because you get emails, like hundreds of emails a day.
Yeah. Um, I mean, patients worry about progression a lot. And I think it's because there's these different buckets, and because they're all rare. Some of them are more rare than others. Some of them are a little bit, like, for lack of a better word, scarier than others. Like aggressive systemic mastocytosis is very frightening. And a lot of times when patients start kind of doing their late night Googling, that's what's going to come up for them. And they're going to be like terrified, you know. But actually, the data is that not that many patients progress from indolent systemic mastocytosis to aggressive systemic mastocytosis, or mast cell leukemia, which would be like the most sort of aggressive form. Um, but that doesn't mean that they don't need to be monitored and progressed. I mean, certainly if, like, you don't have good symptom control, if it's impacting your daily life, you should be going back to your allergist. You should be talking to your physicians, if treatment is not giving you relief or a better treatment of life. I mean, indolent systemic mastocytosis can affect bone health. So you should be having your bones looked at, making sure that you're not getting osteoporosis, getting DEXA scans, or at least periodically, or as often as the doctor says. We really recommend multidisciplinary care if necessary. Obviously, if you have an allergist who's just like amazing and like all up on all the research, and they feel like they can tackle everything and they've got you in good control, then that's amazing. But sometimes patients also need to see a dermatologist if they have a lot of skin involvement, a GI specialist if they have a lot of GI distress. So you really have to, like, figure out the care and the treatment plan as like a team with disciplinary approach. And then I think the big thing for patients is to be open and realistic with your healthcare provider about what is going on with you. And so this is actually kind of answering a question I think you're going to come to in a minute, but it's a good time to bring it up. So I'm just going to go ahead and jump in on it, which is that, like, we hear all the time from caregivers that the patients that they're supporting have gotten so used to this new normal that they do not ask for the full care that they might need. So for example, I'm a mastocytosis patient, and I feel like my symptom burden is very low. And I'm excited to go to Dr. Siri and say, like, I think I'm in good shape. My burden is very low. But my spouse and my partner is here to say, yeah, that's because you're only eating 10 foods and you haven't left the house in 2 months because you're so afraid of running into a trigger, or running into a scent, or running into an environmental concern. So you're not actually, like, living a full life and a better with low symptom burden. Your low symptom burden is because you've kind of put yourself in a bubble and you're not exposing yourself to symptoms. And so it's like, that's like an extra layer of kind of complication of this condition, which is that patients can really self-isolate because of that fear of triggers, because of those fears of reactions. And that can impact their mental health. It can impact their relationships, their social, emotional well-being. And that's when you need to go to your doctor and say, well, I'm not having symptoms right now, but I'm also not living a full life. So how do we strike that balance? And I don't know if Dr. Siri wants to weigh in on that, because that's really complicated.
100,000,000%. I 100% agree with you. It's just one of those things where I think most people who treat a lot of mast cell experts, or who treat a lot of mast cell disease, mast cell experts, will 1,000% agree with you as well, because so often we see that basically that people have seen other people who may not have had as much expertise, and they tell them, I need you to get rid of this, I need you to get rid of that. Then by the time they come to us, they've gotten rid of everything in their life. Like you said, they don't go out of the house, they eat 5 foods or 10 foods. And so I think that our goal is always to expand, not to restrict, but to see, what can you do? What can you go out and do? What can you tolerate with it not causing you symptoms where it's uncomfortable, or that basically it's not life threatening. So, even whether I'm dealing with food allergies or whether I'm dealing with systemic mastocytosis, my goal is always to get you out there to live your best normal life and not to restrict you more. And so it's true that patients, they have a high sensitivity to chemicals and things around them, but they also have a high, I think, tolerance to discomfort and pain, which is, you think that may be not in line with each other, but it's true, because there's so much going on in their bodies all the time because these chemicals are being released And I think if a normal person who basically has never had this all of a sudden felt that one day, they would be like, "Whoa, this is crazy! Like I feel like I have the flu every day." And so I think that realistically for those patients, there is going to be some amount of desensitization, of tolerance, of trying to figure out what can I do in life without having this fear, which really that's what it is. It's this fear of basically feeling worse. And so I think that that's the focus of the treatments. And multidisciplinary, absolutely. If you have osteoporosis, you need to see an endocrinologist. If you are not sleeping well and there's emotional burden, you need to see a therapist and a sleep expert. If there's skin symptoms, absolutely. You should need to see a dermatologist. A lot of patients also have a GI doctor involved because so many patients have GI issues, an allergist, totally multidisciplinary. And then they will check in with their hematologist oncologist to monitor this as well, to make sure it's not progressing. Usually once patients start an adequate treatment, that helps to decrease the mast cell burden, then usually that amount of mast cells in the bloodstream is less detectable. So that's really helpful. But even with that, patients sometimes still feel that small chemical release daily and still feel that burden. And so hopefully with clinical research, with more medications coming out, with other avenues, with more understanding of this disease, we'll get to a better place for some of those patients.